Hello, everyone. My name is Jacob Zelko. I'm a health data analytics and informatics researcher at Jodicke Research Institute. It's an honor to be speaking with you all. Today, I'm going to be talking about my network study, which is assessing health equity in mental health care delivery using a Federated Network Research Model. To give some background on what this study is about, mental health care varies across populations. What I mean by that is there can be internal reasons as to why someone might not receive or go to get mental health care, be it beliefs or attitudes, or it could be external reasons such as socioeconomic factors, insurance status, or care experiences with care providers. Delving more into this, what is the story of this study? We focus particularly on the fact that many patients with mental health conditions are lost to follow-up care. This issue may lead to or contribute to worse outcomes for these patients. In particular, our focus is around the conditions of depression, bipolar disorder, and suicidality. And our research goals are specifically assessing follow-up rates for patients with mental health conditions, find what percentage never receive follow-up after initial diagnosis, and characterizing these populations across multiple different strata, which I'll get into in the following slides. Just to give a sense of where we are in this current study, here's our project plan with our milestones. Shifting forward, you can see that we've actually accomplished a lot with the study so far, and we're in very good shape to not only be on schedule, but actually to be being scheduled as of right now. Research package development is underway. We have secured access to data, and I'll get into that more towards the end of this presentation. So when I say characterizing populations with this characterization study, some axes that I am looking at are axes such as condition, age, race, gender, care setting, treatment, those sort of axes. And as a baseline characterization for my characterization analysis, what we are doing is characterizing individuals being seen for mental health care services at least one time. This includes also hospitalization events. But then we move into kind of characterization 2, or more of a forward-looking characterization where we're very curious about characterizing patients who are seen only one time for mental health conditions. These areas of interest include, how do characteristics of patients who are seen only one time for mental health conditions differ from those who continue to receive care, of patients who are only seen once for mental health conditions, so they continue to be seen for other conditions, and finally, for those who continue to receive mental health care, how do the outcomes for other conditions differ from those who are only seen once? Now, again, these are just examples of areas of interest, and I'll talk more about how you can get involved with the study ongoing. But first, to give some overview of the data that we are currently using. Currently, right now, I'm using the All of Us data set, which is a United States-based data set that focuses around EHRs, particularly for individuals who have been historically marginalized or not represented within health considerations across the United States and health policy decision making, using data from the Centers for Medicare and Medicaid Services, from ResDAC. And then finally, to prototype our ideas and our queries, we're just using test data sources. Shout out to Noémie, which is homegrown here in OHDSI. We've been using that a lot, as well as SynPuff and the Mimic3 database. So some auxiliary goals for this project right now is, and this has been an ongoing discussion that I have seen throughout the OHDSI community, is how can we improve reproducibility, and also endemic to that, or inside of that idea, is accessibility of working with these packages. So right now, this is an open experiment to also utilize packages like RN, and also how to incorporate best practices of study package development to, like I said, improve reproducibility and also improve ease of use that other data partners will have in the future. Furthermore, this past August, I think some of the conferences run together. The OHDSI Symposium for this year, I presented on a presentation called Building Bridges with Julia, using OHDSI R packages in Julia. This network study is actually somewhat of a continuation of that presentation, where we're actually not only designing the study traditionally in R using the OHDSI ecosystem, but also using the Julia programming language to enable high performance computing to do things like ETL, query execution and building, addressing in a different way reproducibility and bridging together these ecosystems to, in fact, reach out to other collaborators and communities and bring the best of both worlds together to get the speed and performance that we would possibly get from Julia with the niceties that we find in the Hades ecosystem. So where you can join on this study. Right now, actively, we are seeking out data partners. If you're interested, please do not hesitate to contact me. We're looking for assistance with clinically validating psychiatry phenotypes. To quote Matt Spotnitz here in our OHDSI community, psychiatry phenotyping can be a very tricky sort of phenotype to develop. So having assistance with this validation would be great. And then feedback on the overall study design and package development would be excellent as well. So with that said, here is my contact information. Feel free to reach out to me at these links, some of my study information as well as conferences. And here are all the wonderful people who have both helped make this study a possibility and for supporting me as I've gone through this study. Thank you so much for your time.